a few more people to join. As you will have just heard, we are going to record this session. So you're more than welcome to put your cameras on, or you can have them turned off. It's completely up to you. But just as long as you're aware that if your camera is on, there's a chance you'll appear in our recording. So just to make you aware there. So we will be making this recording and the recording for each of our webinars available on our website in the coming weeks. I think we will get started. I think a few more people are just joining us. Okay, brilliant. So as I say, welcome. We're really glad that you've joined us this evening. This is a webinar series called CEP Innovate Health, the Foundation Series. And really, it's designed to be a bit of an introduction to innovation in the context of healthcare, and to hopefully give you a bit of an inspiration for developing your own innovative ideas, or if you have an idea already, to give you some sort of inspiration to develop that idea a bit further. So I think we have people from a range of different professional backgrounds joining us today. We have some students from Anglia Ruskin University, of which this programme is a part, who might be experiencing healthcare settings in the context of their placements. We have some NHS staff members who are working in clinical and non-clinical roles. And we have some people who are just interested in innovation and perhaps don't work in a healthcare setting, but have an understanding of it from the perspective of being a patient. We also, I think, have some clinical entrepreneurs who are part of our programme joining us. So everybody is very welcome, and there'll hopefully be a bit of interactivity in today's session. So within small groups, hopefully you'll get the chance to talk to one another and share some of your ideas and what you're sort of working on or hope to be working on. So as you can see, this particular session is entitled Identifying a Problem and Generating an Innovative Idea. So in the session today, as I say, there'll be a bit of interactivity. We have two speakers who'll be talking a little bit about their innovations, their experience of innovating, and we'll be going over a little bit of what we talked about last week, which was a sort of introduction to innovation in healthcare. If you have any questions or comments, then they're very welcome. You can type in the chat, you can raise your hand. We would just ask that you remain on mute while the sort of speakers are talking, but questions, ideas, comments are very welcome. Okay, so just by way of introduction, we are the NHS Clinical Entrepreneur Programme, which is delivered by Anglia Ruskin University, and we are a workforce development programme for NHS staff and also a small cohort of staff from Health and Social Care Northern Ireland. And our aim is to encourage these individuals to pursue their innovative ideas while also working in their NHS roles. And the broader aim, of course, is to sort of develop innovations for the benefit of patients, staff, and the wider NHS. And in terms of the team on the call today, I'll just quickly run through some introductions, and Tamsin and Darren in particular will have the chance to introduce themselves more properly later on in the session. So my name's Jenny Petty. I'm a Programme Support Officer for the Clinical Entrepreneur Programme. We have Dr. Tamsin Holland-Brown joining us, so you can hopefully see on your screen. And Tamsin is a paediatrician, founder of Hear Glue Ear, which is her innovation, and she is co-clinical lead for the programme. And Dr. Darren Hart has also very kindly joined us this evening. He is a principal clinical scientist, an engineer, and a clinical entrepreneur. And he, alongside Tamsin, they'll each be talking about their innovations, their experience of innovating today. Polly isn't joining us this evening. Actually, you might have met her last week, but Polly Sullivan is the programme lead. We also have Lucy Dentis, who is the programme manager, who you can see on your screen. Thank you, Lucy. So just a bit of an introduction there. And so just to recap a little bit last week, so as mentioned, and if you joined us then, thank you, we looked at a sort of a bit of an introduction to innovation in healthcare. And to sort of set the scene for that, we looked at some key documents that express NHS priorities and government priorities for the healthcare system. And so if you are somebody that's thinking of innovating but haven't got an innovative idea yet, it might be a really good idea to look at those key priority areas, and you could focus on innovating within one such area. If you've already got an innovation in mind, you could perhaps reflect on how your innovation links to one of these areas. So it's just something to bear in mind. And one of the documents that we mentioned last week was Lord Darcy's report, which was an independent investigation of the NHS. This was published in September 2024 and identified key areas for improvement, just some of which are listed here. We also mentioned the priorities and operational planning guidance. So this was published in January this year and set out some key targets for the forthcoming year, such as reducing the time people wait for elective care, improving A&E waiting times, and so on. So it's another key document. And since our last webinar, the Fit for the Future 10-year health plan for England has been published. And this sets out, obviously, the key priorities, key focus areas, which I will just list here. Some of these we mentioned last week. So one of the key shifts is from hospital to community, and this idea of the neighbourhood health service. And this is all based on this preventative principle that care should take place as locally as it can, digitally by default, in a patient's home if possible, in a neighbourhood health centre when needed, and in a hospital if necessary. So sort of taking the emphasis away from hospital care and using it as sort of a last resort. There's also a key shift from analogue to digital, and within the plan, if you have a read of it, you'll see there's a lot of talk about the NHS app and sort of having a single patient record and really empowering patients to take control of their own care, alongside many other aspects to this point. Another key shift is from sickness to prevention. So the overall goal is to halve the gap in healthy life expectancy between the richest and poorest regions in England, while increasing it for everybody. And it's really about empowering people to make healthy choices. And so those are the three sort of main shifts underpinning the plan. And you will see there are other key focus areas, such as a devolved and diverse NHS, so sort of pushing power out to different places, providers and patients, a new operating model. There's also a key focus on a new transparency of quality of care. So there will be a national independent investigation into maternity and neonatal services. There will be a reform of the complaints process and an aim to improve response times to patient safety incidents and complaints. There's also a focus on sort of changing the NHS workforce in terms of making sure that NHS staff are better treated, more motivated, have better training, have more scope to develop their careers. And within this point, actually, it was noted that the NHS Clinical Entrepreneur Programme will be expanded, not only for NHS staff, but also for patient entrepreneurs. So they are individuals who have lived experience of a particular health condition and have developed or are developing an innovation that is linked to that health condition. And there's also a key focus on innovation to really drive reform. So there's 5 key transformative technologies that have been highlighted in the report: data, AI, genomics, wearables, and robotics. And there's also mention of an innovator passport, which will be introduced in 2026. And this is based on the idea that once an innovation has been assessed by one NHS organisation, further NHS organisations won't be able to insist on repeated assessments. So there'll just be that one assessment that takes place. And this is just all part of the drive to sort of spread innovation at a faster pace. And finally, there's a focus on productivity and a new financial foundation. And it's hoped that the 3 shifts mentioned at the top there will help to secure financial sustainability. So this is just something to bear in mind. And, you know, if you haven't looked at the report already, it's well worth a read. So if you are thinking of innovating, you could focus on a particular area of these priorities. And just very quickly, last week, we looked at some different types of innovations in terms of clinical entrepreneurs, the problems they identified, and the innovations they created in response to those problems. So just to recap those very quickly, we looked at Hear Glue Ear, which is Tamsin's innovation. She'll be talking about it a bit more later on. A medical device, an app that helps families to manage their child's glue ear condition at home. We looked at a training platform which enhances understanding of dementia care and can be used by caregivers and healthcare professionals. We looked at General Practice AI, a digital hub that has sort of evolved into an assistant for GP surgeries to help with more routine tasks. We looked at predictive health intelligence, which has created a case-finding search engine that empowers clinicians to use existing data to pinpoint people who are at high risk of developing liver disease. And we also looked at 52 North, which has developed a low-cost finger prick blood test that provides rapid, reliable results at home and allows doctors to identify chemotherapy patients who are at risk of neutropenic sepsis. So just recapping those, just as a reminder and a bit of inspiration really, that innovation can take many different forms. It can cover many different areas. And just another example to add. So Funmi Vanessa Alam is a patient entrepreneur who joined our program last year. And she identified a problem or was aware of a problem insofar as her son has sickle cell disease, and Funmi Vanessa realised the challenges of managing the condition, such as making sure her son drinks enough water, maintains a healthy diet, gets enough sleep, and takes his medication. And so in response to this problem, she created an app called the Eli app, which has features that include mood logging, water tracking, reminders to take medication, symptom monitoring, and a reward system to really encourage her son and any other children with a complex condition to make use of the app and to remind them to do what they need to do. And it also includes a comprehensive pain diary to report back to healthcare professionals. So I think last week, somebody that joined the call was sort of approaching innovation from the perspective of a patient, having known somebody with a health condition. So I just thought it's really worth us highlighting the brilliant work of patient entrepreneurs such as Funmi Vanessa in developing their innovations on our programme. So what I'll do now is I will hand over to Darren. I'll just stop sharing so that Darren can share his slides.
Sure.
So Darren, yeah, if you wouldn't mind just sort of introducing yourself in a moment and talking us through a little bit about your innovation, your experience as an innovator, that would be fantastic.
So are you able to see that? If you could are you able to give me a thumbs up or? Perfect. Excellent. So firstly, well, Fumi's innovation sounds amazing. Wow. So my name's Darren. I'm an engineer and scientist. I work here in a hospital in Bath, and it's great to be part of this webinar, particularly because identifying problems, coming up with ideas, is probably my favourite part of a project. Right at the very beginning, when anything is still possible. So it's my pleasure to talk about some of the immersive technology in healthcare work that I've been fortunate to work with others on in recent years. Hopefully that will be a useful example of a problem, and then generating an idea from it that then branches out. And then at the end, briefly, I will share some of the advice I would offer to others, but also probably the advice that I try and kind of tell myself and repeat on a mantra when starting new projects. So I hope you find it of interest. If I can help at all, or you'd like to get in contact, please don't hesitate to. But if I kind of fast forward a little bit to when this all started, let's just advance the slide, just bear with me. There we go. So in late 2020, I was literally scrolling through Twitter and I saw this tweet for a healthcare science innovation fellowship where the deadline had been extended by a few days. It was only for healthcare scientists, and that's what I am. They were giving £15,000 of funding, mentoring, protected time, tutoring. So, oh, this looks fantastic. But I think there was about 3 or 4 days until the deadline. So with very kind support from others, I put together an application, sent it off, and was absolutely delighted when I was invited to interview. That interview came though when there was a lot happening for me. So this is where I grew up, back in Essex. And unfortunately at that time, my dad was going through his end of life care. So he had vascular dementia and bowel cancer. And whilst he and we received really fantastic hospice at home care, he loved where he lived. And I think he found it very, very boring, very frustrating to be confined to a hospice bed in our living room for the last weeks of his life. So yeah, it was whilst I was here that I had my interview, and they were assessing you, I think, on person, place, and project. And my head wasn't really in that space, but I didn't have a project. So at the interview, I very broadly described an idea of being interested in, well, could we look at how we could maybe bring some of the benefits of going outside to those who unfortunately can't through the use of technology? And that must have resonated because I was very fortunate to be offered a place on that first innovation cohort. So in the weeks that followed, I refined that idea a bit more, and it kept on really coming back to this question. So for each of you on the meeting, if you imagine, unfortunately, you are unwell, if you could be anywhere as part of your care, where would that be? If you picture that, you don't have to kind of share where it is. You might be on a beautiful beach somewhere. You might be sat on a bench overlooking an amazing view. But wherever it is, it will be personal and unique to you. Who are you with, and where it is. So when we did a straw poll amongst colleagues, project team, but also patient user groups, the two really strong themes that came out were the natural world, basically being outdoors, and that personalized component. So in the next year, I worked with a local hospice, and we used 360-degree cameras. So these cameras that basically record everything in all directions. And we recorded beaches, paddleboard experiences, garden projects, and then uh, developed a system where we could securely upload that, and patients could view it on tablets, phones, or VR headsets. So this is a shortened sequence of what you would see when using a headset. And you get to kind of a main loading screen, and you can choose generic content. So I think the example that's going to play is a beach. And the final version of this included mindfulness narration. So can you feel the cold sand beneath your toes? Can you try and time your breathing with the waves? And then for the personalized aspect, and it didn't take off as much as I kind of hoped it would, but we would have the ability to lend one of these 360 cameras to the friends or families of patients receiving end-of-life care. And then they could record an environment or activity that had meaning for that patient. So this was a lovely project to be involved with, and I learned loads and loads from it. It also really highlighted that there were lots of other opportunities for using this technology for the patient and staff benefit at scale. So, for example, we created a 360 virtual tour of the hospice to try and reduce some of the anxieties about entering that kind of hospice environment. But equally, you could do that maybe around diagnostic imaging, staff training, induction. So actually, sorry, I should also say we were very fortunate to gain further funding from Hospice UK to continue this work. But that led me to apply successfully, fortunately, to the Clinical Entrepreneurs Programme, which has been absolutely fantastic and an amazing source of support and inspiration. So having been on that program for a little while, and also I think other life events meant that I was maybe a little less anxious about talking to strangers, and more of the mindset of, well, actually, what's the worst that can happen? Let's just have a go. When again at short notice we found out about some funding being offered by Health Education England, I cold called our patient safety lead and simulation lead. And within a few weeks, we'd successfully put together a funding application for some staff training around patient safety. So the culmination of this 12-month project was that we took over a ward for a weekend, and with an amazing cast of volunteer staff, actors and actresses, we recorded 4 kind of interlinked, concurrent patient stories that demonstrated different patient safety incidents. So although they were fictional, they were based upon real events. And we recorded all of this using 5 of these 360 cameras that were dotted around the ward and recorded in synchrony. So the outcome, or the output, sorry, hopefully you can see, if a member of staff wore a VR headset, they could feel as if they were sat at the end of that patient's bed, see how their story unfolded, and see where maybe good practice, not so good practice occurred. They could also kind of hotspot around the ward. So we've just gone over to see Baz on the nursing station, but equally we could be in the bed opposite and kind of watch from that angle. And hopefully that helped convey, what it could be like to work in a busy environment like that, where you have these competing demands on your time. So this project went well and is still in use, and we learned a lot. But one of the aspects was that there seemed to be a real appetite from staff for such VR-based training. So this was the end of last year, and at that point, we found out about some additional funding that was being offered by our local arts university to work with one of their residents. And I went to a network evening, got chatting to a lady who, her and her brother are directors of a classical music record label, and found that actually we had some common shared lived experience around end-of-life care and the power of music to offer comfort and aid kind of memory recall. So we put together a project where we would hopefully build upon our previous work, but now include classical music, where we would create a number of outdoor 360 videos where the narrative of those films was inspired by the ebbs and flows of the classical music. So hopefully a kind of a sneak peek of one of our first videos will play. We had a really lovely morning at a local city farm recording basically baby animals. So staff will be able to view this on a VR headset, but also something that we're trying, which is a little bit new and currently kind of occupying or filling most of my garden, is that we're creating an immersive cube. So I don't really want to say garden gazebo, but if you imagine a garden gazebo with short throw projectors on the ceiling, facing forward, left and right, then if we play one of our 360 films within that, if you and others are stood in the middle, effectively it feels as if you're in that 270-degree scene. And hopefully this will be interesting because we can then start to explore shared experiences. So with the generous support from our hospital charity who offered match funding, we're now running this as a research study. It might not be the most groundbreaking of research studies, but by using validated outcome measures of stress and well-being before and after staff view this content, we hope to have a neat, tidy, interesting study that we can then publish and share with others. So that pretty much brings us up to the present day. I hope that was kind of a useful example of our work. Bringing it back to the theme of this evening's webinar of identifying a problem and generating an innovative idea. I should first say, my trust has very generously enabled me to attend various quality improvement courses, design thinking courses, which have been incredibly useful, and I hope they have subliminally sunk in. But these are more maybe the broad advice that I would offer to others and try and remind myself. So the first would be that lived experience, be it yours or someone else's, is always valid and is only going to complement and benefit a project. So many of the entrepreneurs I've had the pleasure of meeting on the program have maybe not intended to create their startup, but they've had some kind of experience, identified an insightful problem, and then you developed something and tested it from that. And that shouldn't always be necessary, nor would you ever want it to. But if you have that lived experience, it's such a strong motivator, and you have that kind of understanding. And I think it really helps you be fanatical about the problem you're trying to solve, rather than get maybe sidetracked by the solution and coming at it without preconceived ideas. And if this is something that you don't have, or you don't have in such kind of in-depth manner, then public patient involvement engagement is absolutely key. If I took maybe a kind of a bit of a harsh approach on some of the projects I've been involved with over the years, and looked at them about, well, actually, what didn't go so well? What would be the first thing you would improve on if you tried to do them again? So often, be that too many wires, it was too much all at once, were things that either were or could have been identified really early on through better patient public involvement, or kind of really listening to that. On a more positive side, though, if I think of the projects that I've been involved with that have been a success, I would say made a difference, or were scaled or taken up. So often they have stemmed from conversations with colleagues, often in a tea room, often frustrated and complaining about something. But that's such a strong starting point, and one of the many strengths of the entrepreneurs programs is if you can just identify what that problem is and reframe it into the question of, okay, how might we reduce this or improve that? Then that's such a strong start. My next bit of advice would just be simply just get started. I think the difference between innovation happening in an organization and it not is often just someone taking that first practical step. And it often doesn't need to be particularly complex. Again, many of the entrepreneurs haven't necessarily planned to do that, but they've just tried something, got some positive feedback, kept on going around that loop, and very quickly it builds momentum. I think sometimes maybe it helps if you kind of roll a double, or you have a bit of good fortune to get started. And that was certainly my experience with the Innovation Fellowship. It very easily could have not happened. I think it was only really because my wife offered to take our kids to soft play for the afternoon in exchange for me doing their packed lunches for the next week, that actually nudged me into actually applying. And if I hadn't, then all those experiences and the work that followed wouldn't have potentially happened. My next point would be it can be good to scare yourself. If someone says, "Would you like to present at a webinar?" You just say yes, that'd be lovely. But being out of your comfort zone slightly, but maybe just keeping kind of one toe in, can be really good. That's when you learn the most. It's most memorable, and it stretches you. I somewhat regret maybe not being a bit bolder and applying to things earlier on in my career. And it's not to say I would have got them by any means, but actually looking back, what would have been the worst that would have happened? I'd have probably learned a whole load on the way, had useful conversations, met lots of people, maybe got some useful feedback. So yeah, don't be kind of afraid to just try and seize those opportunities, because they're out there. Sometimes you need to bide your time a little bit, but there are some great sources of support. And then, so I don't know if this one is just common to me, or maybe it's to other scientists, but in the past, I think I would tend to work on a project, keep it quite quiet, polish it, and then very nervously show it to someone, when actually I'd kind of built it up in my mind a bit, and possibly be a bit deflated if I didn't kind of get the response I was quite hoping for. Where now my approach very much is to find trusted, critical friends and just say, I've got this idea. I can't tell if it's absolutely terrible, or maybe there's something in it, but I'd really appreciate your opinion on it. So I would really, really encourage you to share early. Please don't work in isolation. The very best projects and teams are where the output is even better than what any one individual would have imagined, because of that kind of unique complementary unique combination of complementary skills. And I think my last point, it's there we are. Just to almost underline that is collaborate and work with others. You can't do it on your own. Also, as much as you might have a plan, there will always be things that just kind of come at you from the side, and you have to adapt and change. So, I would like to think we're just like this. And potentially the most scientific bit of what I have to say is that I'm sure I read an abstract about murmurations like this. And apparently if you make a computer model where the flight behaviors of one bird affect the 7 birds around it, and then onwards and onwards, you start to get this effect. And I say that's definitely been my experience. So, do share your innovations with others, because you don't know what encouragement or legitimacy that will then kind of give them. And I know I've benefited from hearing Tamsin, other entrepreneurs, and the team's experience, because it then kind of feedback to you. So, hopefully this is the future of the NHS, where we're this kind of agile, majestic, kind of beautiful thing. Well, that's what I would like to think anyway. So yeah, thank you ever so much for your time, but particular thanks to the amazing people that I've met from all these groups who have helped this work. Once again, if I can help at all, or you'd like to get in contact, please don't hesitate to. But thanks ever so much, everyone.
Thank you so much, Darren. That was fantastic. And there's a lovely comments in the chat for you to take a look at in a moment. If anybody has any questions for Darren, please feel free to either pop them in the chat or raise your hand. Or there will be the chance to ask questions at the end as well. So there will be time later on. I think, yeah, somebody, at least one person has said they intend to connect with you in the chat there. So thank you very much again. So what we thought we would do now is just give you the opportunity to talk to each other in small breakout rooms, just for probably 10 minutes or so. Just to sort of share your professional background, perhaps why you're interested in innovation, and specifically as well, if you have already identified a key sort of problem area, a key challenge within the healthcare setting that you have experience of, perhaps you could share that within your groups. I know some individuals might have innovations that you're working on as well. You're welcome to share that within your groups, but if you could all sort of reflect on key problems that you think there might be room for innovation within those areas, and sort of share those. So I hope that sounds okay. I'll just try and set up. Lovely. I'll just wait for the other groups to join us, but I hope that was helpful and interesting, and you got to meet some different people. I think there's just a few rooms that we're waiting for. Okay, lovely. I think almost everybody is back in. Yeah, it looks like everybody is now back in. So thank you very much, everybody, for taking part in that. And as I was just saying a moment ago, I hope it was helpful and interesting to meet different people and hear why they're interested in innovation and perhaps what they're working on. If anybody is interested in sort of sharing with the wider group a particular problem that they're interested in or something they're working on, then please do feel free to raise your hand or put a note in the chat. Lovely. Sorry, lovely. Sorry, skipped over the slides there. And what it's worthwhile doing, if you haven't already, if you have got a problem area or challenge in mind that you are thinking of focusing on, it's a really good idea to come up with a sort of problem statement, just a brief summary or description of what the area is, what the issue is. And this can sort of underpin your innovation and can be something you revisit and is a reminder of what's motivating you, what's inspiring you to innovate. So it's just something to bear in mind. What I'm going to do now is pass over to Tamsin Holland-Brown, who is going to talk to us a little bit more about her innovation, Hear Glue Ear, and sort of how her understanding of the problem developed and how she made use of research and really just delved into innovation more. So if that's okay, Tamsin, I'll pass over to you and I'll just call up your slide there.
Thank you. We can move on from that slide. That'd be lovely. Brilliant. Do you know, Darren is spot on. He was talking about find the problem and fall in love with the problem. And I think that that is very good advice. And you hear people saying it quite a lot on the Clinical Entrepreneur Programme. And I guess the reason that they're saying it is if you understand what the need is and you really care about that particular issue, then even if you create the wrong solution, it doesn't matter because you'll start again and you'll create the next important solution, or you'll if you just care enough about the problem, you'll keep going on the solution until you get to the right spot. So I mean, Darren was talking about it and he's completely right. Thank you. Yeah, next slide would be great. And so we might have very big ideas at the beginning about what we're going to build, and it might be that and maybe you should think big at the beginning, but you might end up having to pare it back. And you hear about people talking about a minimal viable product, or MVP, a lot in entrepreneurship or business. And so your MVP, people talk about it being very ugly, and that is certainly true. And sometimes you're building something very big, but what the user needs is just to get over a ramp and you're building a rocket. So also, you know, thinking about how proportional that is. Next slide would be great. Thanks, Jenny. You do have to know about your competitors, and it doesn't matter that there are competitors. So I think sometimes people worry about, for example, if they are speaking to other people or they're speaking to someone who they'd like some money from funding from, or they're trying to get onto the Clinical Entrepreneur Programme, they don't want to write down that someone else is in exactly the same space. It's all right. There should be other people in the same space, because if there are often quite a few people in the same space, because it's a problem that really needs solving. When Apple came on, the computer came into the workplace, there were, I think it was really high, because you kind of think there must be about 4 or 5 different computers, but there were more like 20 different computers. So they came into a really crowded marketplace, but they did something different. So as long as you understand, so people want to know that you know who the competitors are, and then you need to think about what's your unique identifier, what is different, what are you going to make yours about? And then don't worry so much about the competitors, but you have to know that they're there and people will expect it. If on the Clinical Entrepreneur process, people say no competitors and people just Google it and find a competitor, then that's sometimes the reason why people don't get through that sort of process. Next slide would be great. Thank you, Jenny. And so, I don't know, some of you might have been here last time, but I was talking about the innovation that I had created, which we'll call a hearing aid and an app for children. So when you're thinking about your problem, as Jenny said, you've got to write down your problem statement and be very clear about it. But also you need to think about it in a kind of 360-degree way, because for example, I'm innovating for a child, but the child is not going to buy it, and they might not even ask for it. So I have to think about not just who I'm solving the problem for, but who cares about it enough. You know, is it the parents that care about it enough, or is it the teachers, or is it the speech and language therapist, or is it the audiologist, or is it the ENT surgeon who doesn't have to do the operation? Or is it the actual hospital, because we're going to decrease waiting lists? Who's going to actually buy it? And do they care enough about the problem? And sometimes it really helps to write some of the answers to these questions down about your own innovation. Like, what's the human story behind the problem? Like for me, it was seeing children who just couldn't get reading because they couldn't hear the quiet sounds within words, or they felt like they were failing at school because they felt like they were stupid, or they were getting anxious because they couldn't hear and they got told off a lot. Or maybe it's the children who have speech and language problems. But like, what's the human story, and then think about what's the problem behind the problem. Because I was trying to solve a problem for children, but actually the biggest problem was that they weren't getting current NHS services because the waiting list was so long. So there's sometimes, if you think about the problem behind the problem, then you can sometimes work out if you need to be further upstream of your problem when you're solving it. So there are several different versions of that, and who benefits from the problem. So for me, I've got ENT surgeons. You know, I'm reducing grommet operations, and that gives a cost saving to the NHS by giving children a hearing aid very early. But that is a problem for ENT surgeons where grommet operations are very quick and easy to do, and they're a large part of their private lists. And so if I know that, then I know who I'm speaking to and who I'm targeting. So I've got to know who cares about it, and sometimes it's different in different countries as well, which is interesting. So it's good to think about your innovation under all of those headings. Thanks, Jenny. It'd be great. So this is just to give you a little smorgasbord of things that businesses do to have a go. So let's say you've identified your problem, and then one of the things that people might need quite early on is a thought about whether or not how are you going to know whether or not your idea is a good idea. Now, Darren talked about it, and he framed it in a really nice way, because he said he goes and asks people and says, this is my idea, but he opens it up so that they give him genuine feedback. I don't know if I'm off track with this. I'd really appreciate your honest, critical friend feedback. Now, actually, so the next slide is a book called The Mum Test, which is really good. So the whole idea, thanks, Jenny, that's perfect. And the whole idea is that if you ask your mum if your business is a good idea, the idea is that she loves you and she'll lie to you if it is a good idea, or even if it's not a good idea, she'll say, yes, darling, it's brilliant. So the whole idea of that is, and what they're trying to say is, it's not just your mum who'll lie to you. Everyone, thanks to the emojis, I love the emojis. That it's not just your mum. Most people will probably, if you ask your mate, most people, if you say, is this business a good idea? They will go, yeah, great. So how are you going to know if your business is a good idea? And there are lots of different ways. So the Mum Test is a good book to read, because how are you going to know, and how are you going to convince someone else? Because especially if you're early stage and you're just at the idea stage, how are you going to find someone with, I'm loving that, someone says it's like, you've got to find someone with ADHD. Brilliant. Yes. In the lack of that, then make sure that you find ways to be able to connect with people, and ways that you can say to people, now, this is the way that I've done it. So you might want to do very simple. And when I very first had my idea for this headset, I was a bit embarrassed to tell people about it initially. But I had one professor who'd retired who said, just put it on someone and tell me what's happening. Just, I don't care what you say next, just put it on someone. And I can see how right he was about that. So it might be, and Jenny, it might help to go, back a slide, but just to go, there are various different things that people do, and this is within business. So there is formal research that we do within medicine, where you do a formal research trial, and I'll maybe just touch on that briefly in a minute. But there's also these other things that businesses have done in the past, and sometimes that is really simple, like interviewing people and asking them about certain features, or you give it to someone and you get their feedback from it. Then ethnography is just trying to observe people. So you would observe someone interacting with your, say, app or web page, and what do they do, and what do they click on, what are they interested in, how do they react through that. Scenario testing would be, if you're in this scenario, so if your kid actually had an earache at this point, or your kid actually didn't have an earache but actually had difficulty listening, so you might compare scenarios with someone. If you had that thing, what would you do next? But what if this happened? So you might go through scenario testing with a group of different people. Paraphrase testing, I guess, is working out if someone else can tell you back again correctly what you're talking about. We do that sometimes in the clinical entrepreneur program. So sometimes people can we'll do a pitch and we'll say to someone else, what did you get out of that pitch? Like, what did you take away from that? What was the main bit? What was interesting to you? So asking people like to tell you back again what it could be. Then a quant survey is just numerical, like how many kids are affected or people are affected with the thing, how many people can you reach, how many people is this a problem for? It's just finding those numerical values. Then you've got things like ad testing, where you see if people interact with a particular advert around a particular case. Dry wallet testing is stuff like if your product was not available, well, yeah, so you might put up a page saying this might be coming soon, or this is what we're working on. If you're interested to sign up about this, and because you might want to purchase it in the future, then click on this link. So you might do something that gets people to click through. So you've got an idea like, oh, that's interesting. Within 10 days, 50 people sign up for something that they're quite interested that they might want to buy. And the other thing with dry wallet testing is you might want to go, this thing worth 10 quid is going, or 50 quid. And then if people think, no, I'll not sign up to that. So if you've got 3 people who signed up after 10 days, then maybe that, even though you've put it out to people who you think might be interested, that might be interesting to you, that you're going to price that wrong, or you've got that, how you're getting people involved wrong. And again, fake door is the same thing. So you might just have the product doesn't exist yet in the flesh, it doesn't actually exist, but you might have a page going, this is the product, this is interesting if you want to hear more, and then just start to see what people think about it. And so yeah, impersonator testing, actually that's where you could get people to go through your system. So you might have a web page, you might get different people to go through your system pretending they're a patient and see how they go through the system. Again, like the Wizard of Oz does, where they might be saying, Wizard of Oz testing might be where you say, well, for this, when you put in this data, your GP will be given a summary of everything you've put in. And you might, behind the scenes, be taking all of their information, summarising it and giving it to the GP at that point. So it doesn't automatically happen. But again, you're seeing how much value that creates for someone, like potentially the GP, potentially the patient. And then A/B testing is more sort of comparing 2 versions of an app or 2 versions of a web page. Feature adoption is where you might have something, but then you add something, and then you might have a page already, but you add a feature and see how many people are interested to go to that feature, and then they ship it and see where you actually, like your MVP or as near to your MVP, where people say they definitely want it, and you think, all right, well, I'll give it to 10 people and see what they think about it. So so there are various different bits that you can do to just start to get an idea of what's happening. Thanks, Jenny. We could probably and is used variably. Yeah, perfect. We probably talked about that. So for me, I had children who were in a pathway where they couldn't hear very well. They had 1 hearing test, they had a 2nd hearing test because they have a waiting period in between to see if it gets better. So, and then they go on to see an ear, nose and throat surgeon, and then they get an ear operation if it's still a problem. So all the way through that that process, children are deaf, so they can't hear very well, and then that affects their learning and reading and spelling and anxiety levels and everything else. So what I was trying to do was put that intervention in early and then try and find out what parents thought about that. Thanks, Jenny. So initially you can do something called patient and public involvement, and sometimes you can find a couple of £100 to do with your NHS trust, or to do with different research. Often small bits of money, like £200, to be able to serve everyone coffee and tea and some biscuits and get people in a room. And that is the first kind of group that I did of mums who had been through that pathway to a grommet operation, nothing to do with my innovation, just they've been through the pathway and got a grommet operation at the end. And what are their thoughts? Like, I think I know, but what do they think? And you can class that as, like, getting people in a group like that is known as the patient and public voice, or patient and public involvement, or patient and public engagement. You are expected to have some kind of patient and public involvement if you're applying for funding, if you're applying if you want to move anywhere, people will ask you if you've done this. And that just means like, what have you done? And it doesn't have to be big. You can see I had like, I don't know, not even 10 mums, but I learned loads, and I'm scribbling away, and they're discussing between themselves about, oh, for me it was this, for me it was that. And then you're saying, okay, so I was thinking that I might do this. What do you think at that point? But I mean, most of it was about them talking about how hard the pathway was and where the problems were within it. So the problems that I thought I understood as a clinician needed expanding from what the patients thought. And some of them had kids there. So yeah. Yeah, great. Next slide would be great. And the very first study that I did was this professor who said to me, you've got to just put this hearing device on children and see what happens. So I couldn't do children out of my hospital because that would have been a research study. So I couldn't take the children who had glue yet because I didn't know whether this device even worked. And I didn't know if I could start a research study. I'd never done a research study. I didn't know what I was doing. So I took healthy individuals, and gosh, I probably shouldn't even say this out loud, but basically my kids and their mates, right? And a fair few of them. And I put earplugs in and I tested their hearing to check it was the same level of hearing that you would get if you had the condition glue ear. And then I put the headset on them and then I tested them like that. So I did that and I put all my results together. And I went back to this professor and I was like, look, this is the results. And he looked through them and went, yeah, that's great. And I was like, oh, great. So brilliant. Can I write that up? And he was like, no, don't be silly. You haven't got ethical approval and you haven't done it on kids with who've got glue ear. But we know it works. So now you can go and do your research. That'll be all right. So, but actually, even that study was that little tiny study that gave me a lot of confidence to know what I was talking about. I was much more able to discuss it with different colleagues. I actually went to a conference and went, look, I'm thinking of doing something about this headset. Has ever someone else got something better? I needed to know. And I had data. I had something. I knew myself. It wasn't just me. And so then, actually, next slide would be great. And then I went on to do ethics, and there is a really difficult process with ethics. And again, I was a little bit too ambitious with this, but you can do a nice small ethics study, which you can go by the research department in your hospital, and you can go for 10 or 20 people who you're going to try it on who actually have the condition. And I was very green with the whole process. It took me ages. I'm now much faster at it. And there's an online form for any research studies that you have to go and get ethical approval for. You have to say what pieces of paper you're going to use, how you're going to consent people, how you're going to ask them to be part of the study. And it's an annoyingly long process, but it actually is a good way for you to structure how you're going to do your study. And then they give you ethical approval, and then you can go and you can do something small and manageable. Don't do what I did, which is think, oh, I'll just do 1 million people straight away. But just do something small and manageable. 10 people is a good research study. You can write it up. You've got some proper data that everybody's interested in then. Thanks, Jenny. And then you probably already know, but from the time of having an idea to a product being out and actually used and everything is quite a long time. I daren't tell you that it is nearly 10 years, but and hopefully it will be smaller than that for many of you. But it's a long time. So you want to kind of pace yourself on it. And you've got time to plan all of these things out. I think I definitely didn't really appreciate that when I was doing it. I thought I could do everything fast, and actually it will just drain you of everything you've got. So I think pacing it for what you've got. Life happens in the middle. I think Darren was talking about that too. And you have to do things as and when you can. You're not missing out on stuff. You're still able to do it just as and when you can do it. So don't panic if you've got a load of life events that are happening at the time. Doesn't mean you put it down. Just keep it going slowly, but just pace it. Thanks for whoever said that. That's great, Jenny. Thanks. Oh, that's the real valley of death. So at least we're not there. And so when I got my very first data, proper data from a research-controlled trial, then I was off because no one was really interested in me faffing about doing all these things until I produced some proper data. and then everybody was interested, and then I won a little award, and then the hospital were interested, and then the whole thing has a snowballing effect. So it's very helpful. Thanks, Jenny. That's called a box plot and whisker graph, which I never even knew about beforehand either. So, and now look at me with my fancy box plot and whisker graphs. And then once you've got data, you can present it at conferences, and you can interact with all of those brilliant people who are in your space. They can't think of anything better than having a conversation with you about your idea and giving you plenty of feedback about what that is. And also they'll probably end up being the first customers. So, you know, research studies which you might not have thought is your bag before might be your bag, and it's a way to get off the ground. So, and I still find that conferences are something that I just never really did before I was doing innovation, and I find it brilliant because people are prepared to stand there for an hour talking about what we find interesting about the 2 centimeters behind the eardrum, and I find all the people who are interested in those 2 centimeters are with me. Thanks, Jenny. So then I published something, again, not very good at it, ended up getting people to help me, and I learned really to do that, which is helpful. That was the very first one we did. Thanks, Jenny. I'll take the next one. And then the interesting thing is that once you've published 1 or 2 papers, you can, I don't know if I had fully appreciated this, but you can start to publish thought pieces or think pieces about a certain topic. So you're really interested in a topic and you've got a solution. One way to make yourself a thought leader in an area, or to raise your profile, or because you're just desperate to tell other people that this is really an important area, is to write a thought piece in a newsletter or a journal. And I don't think, I'm sorry if I come across as being really stupid, but I just hadn't realized that you could do those thought pieces and that journals accepted those as well as research. And I've now done a few of those, and I actually really enjoy writing them because it's an area, it's maybe around the problem, but it's around where it needs to go, and you're able to start putting in how the whole of medicine needs to work. So just writing small thought pieces makes you into that sort of leadership role that other people are interested in, if that's something that's interesting for you. There are lots of different ways to skin a cat, but it's one way to start thinking about it, is just to write a thought piece around it. And you start to, as Darren was talking about, you start to affect the 7 people who read it, or the 7 people around you, and then that starts to have its own ripple effect. Thanks, Jenny. So these are my main research studies. I've actually published about 20 papers now, but my main research studies were these ones, and I won't go into them in huge detail at all. I mean, the first one was just that we worked out that the bone conduction headsets work, and actually I only did it on 20 kids, but because it worked on every single one of them, it became statistically significant, so I didn't have to do any bigger studies than that. The next one was on an app, and I was looking at the hearing screen on the app to see whether it matched what a hearing screen in an NHS hearing test. So the app's got games for children to do so that they get better at their speech and language skills, but also it's got other things like a little hearing screen on it. And so watching how children navigated around an app, watching how their parents navigated around the app, and working out how many people downloaded it and how many people didn't, and not ignoring the people that didn't, and interviewing them, and then just comparing the results of the hearing screen at home to the ones in the clinic. So the third study, I won't go into too much, but it was actually looking at children whose hearing gets better, but they're still slow to process language, and actually these can work well for that condition as well. And then during COVID was another study that I did that was completely opportunistic. So this was like grommet operations have been cancelled, and I was like, well, I can support everybody with these who's waiting for a grommet operation. And so that's what we did, just locally in Cambridge. And that little paper became very important. So I published that, and then that got taken up by the press. and then the press published it widely, not just in this country, but in America, Bangladesh, various different places. And then low-income countries got to hear about it, and then low-income countries. And now I've ended up mostly working in Malawi and Rwanda and other areas where children have no access to hearing aids. And I've realized that the problem is much bigger, because actually of all the children that can't hear, 80% of them aren't wearing any hearing aids because they can't afford them. And we need to make really affordable hearing aids. And that's now become a much bigger vision for me, which is a much bigger thing that I'm so passionate about, that I can't really stop trying to want to solve that problem, you know. So yeah, sorry, next slide. Thanks, Jenny. Yes, so I think that this is some of the, sorry, I'm just not letting that go. I'm just showing you that the newspapers picked it up. Thank you. Thanks, Jenny. And then, of course, once you have anything that you've written or anything that you've done, then promoting it on social media is something that probably I'm not very good at, but people are really good at that. And again, that engages all of those people that you need to find to have the right conversation with, that you need to be your buddies about, helping you navigate everything. It's going to be a team effort. And so, and not only that, you'll get yourself a bit of a following, and those people who follow you will be interested in buying your product initially. So you'll generate all of those things. And we actually, in the Clinical Entrepreneur Program, when people come onto the program, we actually teach people about how they want to come across on social media, how they use social media in a really positive way, and what you can do to improve your whole business plan really around social media. Thanks, Jenny. Funding is something that is really hard to get all of this stuff off the ground. I did everything on a complete shoestring. Darren, I think you did everything on a complete shoestring as well, didn't you? I mean, we were really rubbing coins together. So, you know, I got tiny amounts of funding. I hadn't done any research beforehand. So even when I was doing a research study, no one really was interested in, because we're all a bit of a risk, aren't we? We're the ones going, hey, I've got this brilliant idea over here. And so people are like, okay, well, how good are you at holding funding streams, and how much research have you actually done in the past, and where's your research team, of which I had none. So so I think then you can do it on small amounts of money. It's all completely possible. I would get £100 or £200 from a charity. I'd make that last as much as I needed to. The only thing I really needed to pay for in a fund to do a little bit of research was to offer to pay for someone's bus costs, or maybe their tea and coffee. And so funding, and also you'll see one of the things that the Clinical Entrepreneur Program does is give people a regular update about what funding streams are available. Thanks, Jenny. So the one, I'm only going to throw this in very briefly at this point, but just when you're thinking about all of these things, like how you're going to gather your people's opinion, genuine opinion about what you're doing or what your idea is, and then possibly thinking about whether you want to go as far as research at some point. The other thing is that if it's something software, or if it's an app, for example, it might well be a medical device. So my app is actually, so weirdly, my app is a medical device, but my hearing headset is not a medical device. It's an assistive technology. So just understanding the smallest bit around that is that so suppose your app is a medical device, there's certain regulatory approvals that it will need. When you're doing your user testing, some of those will tick some boxes for you later in your regulatory approval. So if you've got just some sort of understanding about that, you might have a look at how apps are medical devices and what sort of things, these are the sort of things that you need in the regulatory process. I definitely did not think about this early, but some clever people think about how regulatory approval measures might be needed. And you can do some of that really simply early on, and it will cover two birds with one stone then. So I'm just going to throw that out for you to think about. Thanks, Jenny. Oh, that's it. I'm done.
Thank you so much, Tamsin. I think there's been quite a few comments in the chat, people finding it very helpful, some of the points that you've picked up on. Is there anybody that has any questions? You can either put it in the chat, or feel free to raise your hand. Thank you, Lucy. I can see you've put a link to some more information about Tamsin's innovation. That's great. But if there are any questions, then please feel free to raise them. I know we haven't got much time left, but just to sort of start to wrap up, I suppose, hopefully you will come away from this feeling a bit more inspired and a bit more motivated with coming up with an innovative idea, or if you have an idea already, sort of exploring it in more detail and approaching it from different angles. Salma, did you want to say something? Just see you raise your hand.
Yes, I'd love. Thank you so much. That was so beneficial, and there's so many aspects I hadn't thought of myself. This question is for both Darren and Tamsin. I'm just wondering, when you have an idea, both of I think, Tamsin, you have a very clear idea of what you wanted to create. Darren, I think more like me, I have a broader idea. And I'm just wondering, when you're putting it together, do you try to think of a smaller version and then see how you can scale it up? Or do you think of the whole aspect and the idea as a full and then try to see which parts of it are more important? And then I don't know how to approach the research side of it, how to make sure I'm pitching it correctly. Do I start small and try to take something very small and make sure I've researched it really well before I go in? Or do I look at the bigger picture and make sure I've got all the aspects? Sorry, I'm a bit all over the place, but that's kind of what I'm looking at or thinking about.
Darren, do you want to start? Because this sounds like it's similar to what you had.
Oh, sorry, Darren, to interrupt you. I couldn't hear you very well. I'm not sure if it's just me. Oh, there we go.
Sorry.
That's great.
Yeah,
Thank you.
I'm
Don't
sure
worry.
Britney Spears doesn't have this issue. So I didn't mean to jump ahead to, I think, the next webinar, but Harry, who does the lean canvas work, he talks about what's the wording he uses? Building the most kind of simple thing to test your core assumption or question. And I think that is the key. Just take kind of very small, almost strategic steps one at a time, rather than trying to answer 10 questions all at once. That would be my take on it. But Tamsin, you're
well, Darren, you did, like, when you did it first of all, you didn't have this 360 thing in a garden, did you? You were doing it through a headset when you just had filmed the first few.
Yeah, sorry, mine was in the most simple form, going for a walk with your phone, taking lots of photos and videos, putting it on the Apple TV, and getting quite a profound effect from my dad, who had dementia. And just that point, there's something in that. And I've had kind of similar experiences since, where you just go, yeah, there is something here, and I just need to keep on chipping away at it.
Yeah, I agree. I think it's something really, it can be very basic. Someone wanted to have an innovation where they wanted to mean that the patients could communicate easily what was happening to all of their relatives, like many relatives, rather than, because people can't come into the ward and people don't quite know what's happening. And then in the end, her very first version was just recording what the patient wanted and passing it over to the family and going, is that useful? And that was actually enough to know what people's reactions were, sort of similar to what Darren was saying. Yeah, my MVP was definitely not a product. It was stuff pulled off the shelf. Yeah, a bit of that and a bit of that. And, does that work? Yeah, so I think, yes, Darren said it beautifully, which is keep it as simple as possible at the beginning, and then you can expand out. And I think if you're applying to the Clinical Entrepreneur Programme, then you just having some understanding of how you might approach it, or understand what other people think, or what that background research is, like backgrounds, what's the background to all of this, is something that people will like to see. And then you can be very visionary in where you see it going, because you're going to start small, but you're going to think very big. And having those two, you hold both of those things as an innovator. What's manageable, but where you can see it going.
Thank you
I
both.
love that. Start small and think big. Thank you so much, both of you.
Thank you for your question, Salma. Jonathan, would you like to ask a question?
Yeah, thank you so much for both of your talks. My question's about both Darren and Tamsin have got things that they developed, which were both a hearing aid and were the app. And the concept that I've got an idea of as a problem and a solution is much more around the idea of developing a better interface for patients for information. So it's a lot of website development or app development. And I suppose part of it is how I use my energy in leading up to the pitch. Is the advice whenever you're developing it's like an IT development which requires investment, etc., that you try to work up something crude yourself, or is it better to just focus on the problem, maybe do some focus groups to maybe understand it from the various perspectives? I'm just kind of looking for a bit of advice as to how to use my energy in the run up to applying.
Yeah, I can see that. I think actually people have got onto the program with both approaches. So I think that people have been really good at understanding, look, here is my idea, and I've got people to say that they think this is a good idea, and based on some other research that I've done, this is a good idea. So I think, and that is definitely enough. We've got Lucy here as the program manager, and so Lucy, you see those kind of come through, don't you? Those applications come through, and some of those are really very strong like that. Some people do really well by having a very simple web page or couple of web pages where they've started to gather a little bit of detail. But I can understand that and some people get as far as maybe a wireframe to something. So you've got a rough outline to something with, but I mean, you want it to be much more complex. You were talking about having information really for patients. So you could, I mean, it would be equally valuable for you to focus on one particular condition or one particular set of patients and have a look at that page and then see what people thought about that, so that you had an idea about whether you were in the right ballpark. Because a lot of it is for the application, but most of it's for you, because you need to understand before you get too creative and too big exactly what that North Star is for you and what the people who are consuming that information need. So maybe drive what you need and it will drive the application form. Lucy, did you have anything to offer on that?
I was just going to add, we do ask for a little bit of market research when we do applications. So you need to understand what else is out there, what could be coming as well. So I think it's really important for you to focus on that problem. That problem has got to be strong, and that's going to push you through, because if there's a clear problem, then there is a need for a solution. So you need to know if it's just within maybe your trust that maybe you're working in, or is it wider afield? Is it like a huge problem? So I would really focus on that. Yes, you could do a really rough mock-up, but I would just be cautious until you've done that bit of research, until you've actually spoken to colleagues, potentially patients, about what they think. I think that's where your time is actually better spent. And that's what we like to see when people have put applications in. We do get quite a lot of people who put the solution first, because they're very married to the solution rather than the problem. So I would always be a little bit cautious around that. I don't know if that's helpful at all.
Yeah, no, that's great. Thank you. And Darren, have you got something?
I would kind of completely echo both of those points, but with Lucy's there, I know in the past I've created wireframes basically out of PowerPoint slides and then shared those and got feedback, and that has been incredibly insightful. Jonathan, I don't know if you have a kind of coding background, but whilst that might be your comfort zone and something that you can quite kind of happily get on with and progress, I think so often the solution you have now compared to where it might be in a year's time, they often look so different. So having that core foundation of understanding the problem, getting feedback earlier on is probably the more kind of wise use of your time, I would suspect.
Yeah, it's an idea that I've been sort of sharing with colleagues over quite a period of time and getting feedback, and both locally, but I know that it's a national problem as well. And I think I just got to the point where I thought, oh, do I spend some money and try and ask if a local company could develop it? Because I've got no coding experience. I've got a lot of experience in taking products and systems and workflows, but actually sitting down and coding. And like I looked at Python and some AI development of websites, and I thought, oh, do I do it or do I wait? And I kind of tempted to wait and just focus on, which is a really good point actually about the wireframe, like creating some PowerPoint slides about how it might look and how it might interact. And I have, oh, I think one of the things I would take away actually is I might actually go to my user group and just sort of just double check, because I think I've got scope to be able to do that fairly easily as well. So that's, yeah, there's some bits in there. Thank you very much for all of your comments.
Have you heard about no code as well? So there's now no code apps where you can put your sort of drag and drop. So there are, so I think there are other options out there. So yeah, you might not need to code in Python.
Yes, that's what I was afraid of. I have seen there's a couple of apps like Cursor AI and things like that, which will do app development. I guess I just didn't know whether to play or whether to put my energy into something else, if that makes sense.
Yeah.
Sorry, Jonathan, just to jump in as well, and I don't know if this is of use for anybody else, but Health Innovation East are actually working with a company called Cognis, and they do an innovation sandbox around apps developments for MVPs. So I'll put the link in the chat. They're actually open to expressions of interest at the minute up to the 15th of August, I believe it is. So you might want to have a quick look at that. There you go.
Thank you. That's really helpful.
Brilliant. Thank you very much for your question, Jonathan. Just as a sort of parting slide, I've just put up some sort of key questions that if you are in the process of sort of brainstorming an idea for an innovation, or you've got a basic idea but you're not sure how to develop it, so it might seem a bit overwhelming, all the questions, but just some different things that you can think about. So, you know, as we talked about, really getting to understand the problem, really understanding who the user or users would be of your innovation, and also sort of the practicality of how it would be implemented and what risks or what limitations or barriers might you come up against. And then sort of reminding yourself of the impact, both short term and longer term. But I think we're actually at 7:30 now, so I'll draw it to a close. I'll just stop sharing. But thank you so much to everybody for joining. Thank you, Tamsin and Darren, for sharing so brilliantly about your innovations and your experiences. Our next session will be not next Tuesday, but Tuesday the 22nd of July. So we're just skipping over next week. It'll be on the 22nd of July. And as mentioned, that will focus on sort of a lean canvas approach to business planning. So hopefully it will help you sort of to refine your ideas and make a plan going forward. So huge thank you everybody for joining, and we hope to see you at the next session.
That's brilliant. Thank you so much. Take care. Yeah.
Thank you very much.
Thank you.